There are many things in the world that we can't change. There are many challenges. But one area we do have a lot of control over is the way we respond and our resilient attitudes and the way we focus on global health. That's what today is all about. That's why I'm very excited to be able to invite to our stage very shortly the Prime Minister of Japan.
日本は2000年、九州沖縄サミット以来、国際保健をサミットの柱に据えてきました。経験から学ぶことができるのが人類の強みです。新型コロナパンデミックの教訓から学び、G7 首脳は5月の広島サミットで国際保健のリーダーとして行動し、世界全体に貢献する、こうした決意を示しました。民間資金動員については、広島サミットで承認されたインパクト投資を通じて民間資金動員を加速させるグローバルヘルスのためのインパクト投資イニシアティブトリプル I の立ち上げを宣言いたします。新しい資本主義のグローバルな展開ともいえるトリプル IA、ゲイツ財団、あるいは GSG 諮問委員会、インパクトタスクフォースはじめ関連機関からのご協力に心から感謝を申し上げます。本年8月、JICA はブラジルのドトルコンスルタ社の医療アクセス改善事業へのインパクト投資に調印をいたしました。これは AI を活用して低中所得者にプライマリーヘルスケアを提供するものです。また、エーザイ株式会社は国際保険におけるインパクト会計に取り組んでいます。こうした先行例も見ていただきながら、各国企業、また機関の皆様方には、トリプル I へのさらなる参画を呼びかけたいと思っています。
I especially want to recognize Prime Minister Kishida and the government of Japan for bringing the G7 nations and so many public and private funders together behind two powerful efforts. First, Triple I for global health, and second, the MCM Delivery Partnership for Equitable Access. We do need increased investment in global health. Between 2000 and 2015, global health made incredible progress by every measure. Key statistics like the number of children dying under 5 were cut in half, fully achieving the Millennium Development Goals. So following on from that, the Sustainable Development Goals driven by the United Nations set an ambitious target to cut childhood death in half again. Well, as you know, a variety of challenges emerged that we hadn't expected, starting with the pandemic, but war, economic conditions, lack of stability in some locations. And so it's been a big challenge. And since 2015, our progress on health metrics has largely plateaued. Across all of our diseases, we need these tools. They have to be very effective and very inexpensive. And so the spirit of Triple I, where we engage the private sector, is critical to this future progress. Global health has a huge impact on countries. The human development of not only avoiding deaths, but also solving malnutrition problems gives you your basic human capital that allows your country to move forward. So we have to rededicate ourselves to regaining progress, to achieve ambitious goals like the eradication of polio, and make sure this preparedness is available everywhere. So thank you to everybody engaged in III. It's going to be a new tool that'll help us accelerate work in this incredible cause.
The bedrock of health financing for all countries, as you know, must be domestic public financing. But many low-income countries also rely heavily on external resources to fund their health systems. And in today's announcement, I would like to congratulate His Excellency Prime Minister Kishida on the announcement of the launching of the III, and like to thank also the Gates Foundation for their partnership in that initiative. And we welcome the Impact Investment Initiative, which could play a vital role in mobilizing resources to support countries in their journey towards universal health coverage. It complements WHO's Health Impact Investment Platform, which we launched with 4 multilateral development banks earlier this year, the European Investment Bank, African Development Bank, and the Islamic Development Bank.
We also have a list of impressive organizations that are part of our advocacy and advisory partners. And as of last night, there was 37 investors and partners who signed on to be our founding partners. I want to thank all of you that have for coming together to start this collaboration to launch this very ambitious, important initiative. The establishment of III, which is Impact Investment Initiative for Global Health, was endorsed at the G7 Hiroshima Summit in May. Hiroshima symbolizes peace for mankind and the human spirit to overcome extreme difficulties to strive for a better world for all. Today, III for Global Health calls out for the international community for another ambitious plan, mobilizing private sector resources through impact investing in global health to empower the foundation for human capital, which I believe is essential in the development and prosperity for any society. The Council for the New Form of Capitalism, established by Prime Minister Kishida, proposed initially to Japan and now to the world of incorporating the concept of impact into global health. We should not exclude capitalism from providing solutions to global health, and capitalism definitely should not leave behind global health as an externality. Impact investing is the intent to provide solutions to urgent environmental and social issues without losing sight of economic return. Impact accounting is an attempt to translate impact into the language of corporate value. Now, mobilizing private resources for global health, this is a very, very ambitious goal. That's why we need many, many new friends like all of you and others who share the common vision that impacting global health makes good sense and is willing to contribute, collaborate, and implement towards achieving this common goal. In my initial remarks, I mentioned that I needed a lot of friends to get this done. And I want to introduce you to 2 new friends that is fundamental key to make this III for Global Health a success. My co-heads, Yodi Alakija and Steve Davis. Can you come up to the floor, please?
Well, it's our honor and privilege to be asked to be leading this initiative. A lot of work to be done. We've heard a lot of the speakers today lay out the problem that we have to keep tackling these enormous challenges by crowding in more partners and more investors. So we hope that this III effort can accelerate that work around the world. We're very appreciative of all your support, but our work is ahead of us. So hopefully we'll be here to celebrate some successes in the next year or 2.
Thank you very much. I'm also likewise very honored to be here with my co-heads and looking forward to the challenges ahead. It was good to hear earlier previous speakers refer to III as moving to action and to execution. I think there's been a lot of talk. We have diagnosed the problem. We have diagnosed as many problems as we possibly can. And one of the solutions is money. It's financing. It's seeing health as an investment as opposed to a drain on our resources. It's looking for the return on investment the private sector can get when they invest in our health. Health is not something for us to shy away from as private sector actors, but it's something for us to lean into. And we hope that all of you who are here and those who have already left will join us in that partnership, the partnership for action, the partnership for making sure that the world truly leaves no one behind. Thank you.
So impact investing. Impact investing is intentional. It measures what is happening, it manages the impact, and it reports transparently. And that gives it the rigor that IIIGH will need. There's over 1.2 trillion US dollars of impact investing globally. IIIGH aims to improve access to health and healthcare for the people who need it most, using impact tools, impact investment, mobilizing capital, especially with private capital, and it will bring the health and investment communities together towards achieving universal healthcare. We've now had 37 founding partners already joined in to IIIGH, creating blended finance, reaching hundreds of millions of people at low cost, using digital technologies, working with trained healthcare workers, addressing understanding and creating the trust that is important in healthcare. We have also been honoured to have strong support from a number of other organisations which are also working to improve health and healthcare in LMICs. These 8 organisations have already agreed to become advocacy and advisory partners for the III, and each will add their own distinct and valuable approaches aiming for the same goal. We know that healthcare provision in LMICs is well below what's needed. We know that private finance in this field is going to be essential, but is already too low at the moment. And this is also the case even in development finance. So we see the III program as driving positive change for the future. The use of impact investing and impact tools will give significant drivers for achieving the SDG 3 goal of ensuring global health in LMICs.